Good morning, everyone. My name is Rita Kaul. I'm one of the nurses here at Two Rivers Health Department. Uh, this is the monthly clinicians call, and our mission here at Two Rivers is to just engage the collaborative partners that we have throughout the counties, the community leaders and the public. We just want to promote healthy lifestyles and provide some preventive education just to ensure we have environmental quality and create more healthy and safe communities for all of us to live in within our district. Our vision is that we have a health department where all are able to safely and actively live, learn, work, and to play in our communities. That at Two Rivers, we do facilitate collaborative partnerships and unique approaches that educate, empower, and engage the local community partners, the healthcare providers, and also the political decision makers in our community leadership and in the public in general. This is our staff here at Two Rivers. We have a great crew. I'm in the middle here down in the bottom. My name is Rita Kaul. I'm one of the community health nurses. So let's talk about our we want to talk about fall, but we also want to talk about fall prevention. So we just want to talk about keeping you and your family safe and active. During September, I think it's the 17th through the 24th, is Fall Prevention Week. And so I just wanted to emphasize that because it can just change your life. If there's a fall in your family, if you yourself fall or one of your loved ones, it can just change everything about your life. And so we want to just kind of emphasize that and see there's some things that you can do to change your home and maybe prevent some costly injuries. You can be a partner and participate in falls prevention. This conversation guide has many purposes, and I will be attaching like a little worksheet that talks about falls prevention. But for right now, we just kind of wanted to talk about some of the risks and the implications that a fall can have for you or your loved ones. Next slide. So falls are common. Falls are the leading cause of fatal and non-fatal injuries in the older Americans, and 1 in 4 older adults fall each year. Every 11 seconds, an older adult is treated in the emergency room for a fall, and every 19 minutes, an older adult dies from a fall. So you can see how significant this is. Falls can cause serious injuries. A broken hip or broken bones or even head injuries can just cause a traumatic brain injury that can change your life, even for younger adults. These falls are very costly. The fall injuries can be over $30,000 just for a hospital stay from a fall. Caregivers have a challenging role. Research has shown that the toll on family caregivers' health appears to increase over time. So if you can prevent a fall, whether it's as a caregiver or a person you're caring for, you can save time, stress, and money. Some of the things that they talk about in the fall prevention information is there's 6 things to kind of follow, and I'll send these as an attachment. But the number 1, finding a good balance and exercise program. Tai Chi is a very good practice to get into as far as learning good balance techniques. Talk to your healthcare provider. A lot of times they can assess whether your knees are getting stiff or whether you need physical therapy, or just, directing you to the proper healthcare for you. Each person is individual, and you might have some increased needs that they can maybe help you with, or maybe order some home physical therapy, or maybe just, try to get you in so that you can keep those muscles or those joints limber. Review your medications with your pharmacist to make sure that they don't see a change in side effects. Sometimes you can be on the same medicine for a long time, but yet the side effects are accumulating and you don't even notice it because it's over time. So if you can just, have a good review of that and make sure that you're tolerating your meds okay. get your vision and hearing checked. Make sure that you are able to see and maybe hear the things around you. As you age, your vision and hearing does change, and so you just need to be aware of those things. Keeping your home safe, removing the trip hazards. Rugs are just a big problem and enemy for us. So just removing those hazards, and then put some grab bars up in the shower if you need them. Just making sure that you think of those things ahead of time before you need it. And then the last one, number 6, is just to talk to your family members and list their support in taking simple steps to stay safe. It's not just a seniors issue. A lot of times I think seniors don't want to bother somebody, and they get up and they clean the leaves out of their gutters because the leaves are full. And so if you involve your family members, they can help think of that ahead of time and just say, okay, mom and dad, we're going to clean your gutters this year. That could be a good Christmas present for them. So just kind of think about those things ahead of time. So I just want to really emphasize that. And then the next part I want to talk about is the Live Smiles program. That's our rural Nebraska program. And it's just a program where we have staff that go around to all the schools and do the dental exams. They've started full-fledged. They're got a schedule that they go to all the schools, and they're doing very well. They're having some good success with referring people on. But this is just like an initial exam that they do, and just make sure that the teeth dental care is provided for all children. The next thing I want to talk about is respiratory syncytial virus, or RSV. That's a common respiratory virus that usually causes mild cold-like symptoms. Most people recover in a week or two, but RSV can be very serious. Infants and older adults are more likely to develop severe RSV and need hospitalization. Vaccines are available to protect older adults from severe RSV, and the monoclonal antibody products are available to protect infants and young children from severe RSV. And we do get a lot of calls about this. We don't have the RSV vaccine at the Two Rivers Health Department, but you can, for the older adults, they do have that available for the over 65 folks at Walgreens. And if there's anyone that knows of other places, you can chime in or put it in the chat. And then the monoclonal antibody, the Beyfortus, is available at Children's. So we just try to refer people there. Again, if there's other sites that are offering that, please put that in the chat so that we can all know where to refer people to. They do have a new RSV vaccine out that just came out for the 32 to 36 week pregnant population, and that vaccine is available. It's through Meridian Health. And so you could probably Google that site and try to see where it is available, because that vaccine has just come out and has just become available. So I encourage you to look if that situation if you are in that situation where you are needing the RSV vaccine during pregnancy. So the main thing about this was from our health advisory, that the increased RSV activity in parts of the southeastern United States, and we've just got some, if you go to the CDC, you can get all the information that you need. It encourages clinicians to prepare for and implement the new RSV prevention options. And this is where it talks about the Beyfortus, and just making sure that it's for infants under 8 months, and then the young children at higher risk. So just a little information and a little guidance. You can go there and read more about this vaccine if that is your situation and that you're seeking more information on this RSV vaccine. And West Nile has not gone away. We are in the just prime season for that. And you just think, what am I preventing? And so I just wanted to include this slide. We did have this on last month, but it's just such an important thing to be aware of. We just want to make sure that you're, being aware of West Nile virus. It's the leading cause of mosquito-borne disease in the continental United States. It's more commonly spread to people by the bite of an infected mosquito. Cases of West Nile virus occur during mosquito season, which starts in summer and continues through fall. And I know this year we have just a tremendous number of mosquitoes out. I don't know if that you're aware, but we have people that are counting mosquitoes, doing monthly mosquito counts, and they're very, very good at their program. And we do have like a huge number of mosquitoes this year. I think it's like 6 times the normal amount of mosquitoes. So just be aware that it is a problem in our area, and we just want to make sure that we're just having people keep an eye out. Be thinking of your signs and symptoms, your headache, body aches, joint pains, vomiting, diarrhea, and rash. And some of the more severe symptoms for a few people are the high fever, headaches, neck stiffness, stupor. Sometimes people get disoriented. Sometimes they go into a coma, may have tremors, convulsions. It's like a cardiovascular, like a neurological effect where you have the muscle weakness, sometimes vision loss, numbness, and paralysis. It's very, very serious. And always be thinking of this in the back of your mind. If you have any of these things going on, get to the ER and get that test done. We here, the nurses at Two Rivers, we are looking at those numbers every day. The reports come in, and we're able to be able to report these cases to the CDC. So it's just really important to get into that, into your doctor if you have any of these things going on, because it might be, what the problem is for you. Next slide. So you can see here that we have the mosquito-borne cases. These are the most recent numbers that we have here in Nebraska. We have 30 West Nile virus human cases that have been reported. 7 have been from blood donors. 1 associated death has been reported. 2 West Nile equine cases and 2 bird cases. You can see here where it says mosquito surveillance, like in the middle here where it talks about the statewide mosquito risk, West Nile mosquito risk. The 2 regions that are having the most problems are central and southeast Nebraska with the very high levels. The 2 regions, the north and panhandle, are still in the high risk. In the metro area, moderate risk, and here in west central Nebraska, we're at low risk. So you can see that it doesn't mean that you're out of the woods. So low risk does not equal no risk. So always take those precautions about, putting your repellent on, and, wear long sleeves, and really be cautious and aware of the mosquito population, of what you're doing outside. If the mosquitoes are really bad that night, it might be best just to go in and skip that part of your night and just try to protect yourself from getting bitten. Next slide. Okay, the next thing I wanted to talk about was Legionnaire's disease. And the reason for that is because I know a lot of you do a lot of monitoring for your fountains, your water supply. I know a lot of people are doing daily checks. And what you're trying to prevent is Legionnaire's disease from getting to people that are unaware. So basically, it's a very serious type of pneumonia or lung infection, and it's caused by the bacteria called Legionella. So if you develop pneumonia symptoms and you have been exposed to Legionella, you need to see your doctor right away. Be sure to mention that you have a hot tub, or if you have spent any nights away from home or stayed in a hospital in the last 2 weeks. So Legionnaire's disease can cause pneumonia symptoms, and that would be like cough, shortness of breath, muscle aches, headache, and fever. The important thing is that Legionnaire's disease can be very serious, but it can be treated with antibiotics. And those are just the drugs that will kill the bacteria. Most people get sick, need care in a hospital, but will make a full recovery. However, 1 out of 10 people who get Legionnaire's disease can die from that infection. So that's why we do our constant monitoring, making sure that our temperatures are all correct. You want to have that temperature of your water, and then the right range. You don't want to have it. The warm water is what causes a lot of the problems. So you want to make sure your temperatures are, either cool enough to ward off that bacteria, or hot enough to maintain destroy that bacteria. So your common sources are your water used for showering, the cooling towers as part of a large air conditioning system, decorative fountains, and hot tubs. I know I used to work at the cancer center, and we checked that fountain every day for that temperature, to making sure that it was not, that water was not too warm, because that can just be a breeding ground for that bacteria. And it's respiratory. It's caused by the droplets that come from the water. So if that water would splash up in by your face and you would breathe that in, and that's how you could get the Legionella. So just an FYI, just to make sure that you're all aware of, that what you're doing is a good job. Next, I want to talk about the Train the Trainer program that we have here in Kearney. It's coming up here October 10th. And what this is training to learn more about lead exposures. And this is a big deal. We have lead exposure in our homes, and there's things that we can do. The Train the Trainer would be for people that want to help other people. You can learn how to use the curriculum to protect your community from lead exposure. That's from 1 to 4 at the public library in the North Platte room right here in Kearney. So you can see here to register. You can look at the website on the bottom of the page here, or you can scan in on the scan here. There's also a session in the evening from 6 to 7:30, and this is just for the general public on understanding lead. And this would be a great thing to go to. You can learn about lead and how to protect your children. There's so many things that you can do to make your home safe. You can make sure that you don't have any chipped paint. You can make sure that everything, dust and particles in your home can cause problems. And it also gives you things that you can do to protect your children with the foods that you prepare. It just can tell you that fruits and vegetables are a good choice to give your children, foods high in calcium. So it's just going to give you some really good guidance on how to make your home as lead safe as you can. And lead, again, is another very serious illness. If you get this, it's very neurological. There's all kinds of side effects and symptoms that people have. It can interfere with your learning. So the more you can protect your child, the better it is. We do monitoring here at the public health department. All children that are 1 year of age get tested, and then if their lead level is high, then we ask that a venous sample is drawn. If that is high, then we continue to monitor, give more information on things that you can do to reverse the effects of lead. And we just keep on it until that lead level comes down. We do have an inspector that comes out from Lincoln that is able to come and test your home for any sources of lead. So that is actually a good thing, that they can come in and give you some extra guidance on how that you can make that lead level come down. So that would be a very good session to attend if you have any concerns about lead levels in your home. The next thing I wanted to talk about is bats and rabies, because that continues to be a major problem. And this is the season for bats. Around Labor Day is when bats are really in full force. And so you really have to be on the lookout. Bats are the leading cause of rabies deaths in people in the United States. People and domestic animals should avoid contact with bats, and bats should never be kept as pets. Now, I don't know who would want to keep a bat for a pet, but you just want to make sure that you don't touch them anyway. Rabies can spread from to people from bats after minor, seemingly unimportant, unrecognized bites or scratches. Rabies, the post-exposure prophylaxis, which includes vaccination, is recommended for any person with a bite or scratch from a bat, unless the bat is available for testing and tests are negative for rabies. If you find a bat in your home, if you have been in a bedroom that has a bat in it, if you get woken up in the middle of the night and you feel something on your face and it ends up being a bat, you have to try to catch that bat and send that bat in for testing, because they can bite you and you don't even know it. They have little prongs that they can stick in your skin, and they can land on your face or something, and that can you can get the rabies that way. So you want to make sure that you can get that bat collected and take it to your veterinary to get it tested. And if you do collect the specimen, you want to try to pick it up without disturbing it, put it in a container and shut the lid, and then take it to your veterinary, and then they can send that in for testing. Bat bites can be very small, so a person might not always know when they've been bitten by a bat. The prophylaxis should be considered when direct contact between a person and a bat might have occurred. Even if you slightly suspect it, you need to get checked. A bite or a scratch cannot be confidently ruled out. If you've been sleeping, you don't know if that bite has occurred or not. If you wake up with a bat in your room, you may have been exposed to rabies and should see your doctor and call your health department, even if you don't feel the bite. The healthcare providers can conduct a risk assessment to determine if you need rabies vaccination. If there's no clear explanation for how the bat got into your home, you may also need to consult a bat remediation specialist to determine if bats are living in your home. It's a big deal, and you want to make sure that you try to protect yourself from any bats in your home and protect yourself from bat bites, because it can really lead to a big problem with rabies. One of the last things I want to talk about is we have our clinics for this month. We're just giving flu shots for right now. This is the schedule. We'll be at El Tropico and well, that's already passed in Lexington on the 8th. And then the Two Rivers Health Department will be here on the 14th. And I believe the 18th has been canceled, if I'm not mistaken. And but we'll be doing different clinics throughout the different locations throughout the counties. And so we're closing that one so that we can be in other locations. In Holdridge, we'll be there on the 20th from 4 to 6, COZAD at the Methodist Church on the 27th, and Thursday the 28th, we'll be in the office there at Two Rivers. And so you can go to the Two Rivers website to go ahead and make an appointment for that as far as the clinics go. As far as an update on the COVID vaccinations, the advisory committee on immunization practices is meeting today. That's on the new COVID vaccine that's out. So they will be making some decisions today. First, the FDA approves the vaccine. And then after that, then the CDC comes in and gives the guidance on when and who it can be given to. So we are, anxiously awaiting when our next steps are as far as COVID vaccinations. So kind of stay tuned. This advisory committee immunization practices for the public can listen to that. And I believe Katie's going to put that in our chat. So you'll have access to that. If you are interested, you can go in and listen to that today, because it's very helpful information. And it's like, this is where the buck stops here. This is where, you'll get your most definite knowledge as far as the vaccine and the process it's in right now, or the stage it's in right now. So you will be the most knowledgeable by, listening into that information from today. So that's all I have prepared today. I don't know if there's any questions, and I don't know if I can answer them, but I have colleagues that can. So if you have any questions, please share them, please.
Rita, this is Katie Mulligan. I am not seeing any questions. I will mention that lead training, the train the trainer training, is really targeted, hopefully, for our clinicians in our community. And you can take that back to your offices, or find the person, the clinic social worker or the clinic nurse manager, who might be a good target to bring that back to their office and help the lead cases that you identify in your office.
Right. And I think it's free, correct?
It is free, and it's hosted. It's not even us, it's the EPA. So we're bringing in about 4 people from EPA Region 7 in Kansas City, and they will be speaking. And we just get to be there and say, hey, we had a lead case in our district, and let us tell you about it. And did you remember that we have Hornaday Manufacturing just down the way, and those things like that. So we're not even the experts for this meeting. It's others.
Yeah. So that again is like that will be the most knowledgeable people sharing what they know with you. So great opportunity. And if it's free, that's the right price. So I see we have a question.
Go ahead. The agenda for that meeting is in the chat.
Okay.
So
I can't see the question, so.
sorry about that. Glenna from Family Medical Specialties asked when the meeting is for the COVID vaccines. The meeting is today for the ACIP, and I found the agenda, and those meetings really are available to the public, and I'm having trouble finding the link right this moment. It starts at I believe it's 10 a.m. Eastern time. So it starts in 5 minutes. From my experience of sitting through those meetings, they're not going to make any actual decisions until this afternoon. So I will work as fast as I can to get you that link. But the agenda is in the chat, and I'll pop it in the chat again.
Awesome. Okay, I think is there another question, or was that it? Okay, there's our link there. So, okay, I think that I'm done for my portion, and I just want to encourage you to go out and enjoy the fall weather, have a cup of coffee, go out and sit and enjoy the fresh air. And it's so nice to just sit out there and not be hot anymore. So enjoy your coffee time outside or whatever you want, and just take a deep breath and enjoy the afternoon. Thank you.